Hi everyone. Thiazide diuretics are the first line drug for the treatment of hypertension. Thiazide is also very commonly asked in the exam. So let us understand in today's class about the mechanism of action, therapeutic uses, side effects and drug-drug interactions of thiazide diuretics. So let us begin. So first of all, what is diuretic? Diuretics are the drugs that promotes the excretion of electrolytes and water into the urine. Diuretic achieves this action by interfering with the one or more reabsorptive processes which occurs at the different segment of the nephron. Classification of thiazide diuretics includes hydrochlorothiazide. This is one of the commonly used diuretic. Hydroflumethiazide, benzthiazide, then chlorthalidone, which is one of the longest acting thiazide diuretic, metolazone that you can prescribe even in case of the severe renal failure, zepamide, indapamide and clopamide. So this was about the classification of the thiazide diuretics. Now coming to the mechanism of action of thiazide diuretic. So thiazide diuretics acts in the distal convoluted tubule. Thiazide diuretics decreases the sodium reabsorption and increases the water excretion. So here you can see in this figure that the thiazide diuretics inhibits the sodium chloride symporter on the luminal side of the distal convoluted tubule, and ultimately it decreases the sodium reabsorption. As thiazide inhibits the sodium chloride symporter, more sodium will be available for the exchange with the potassium in the collecting duct. So this will ultimately result in increased excretion which is parallel to the natriuresis. Natriuresis means sodium excretion. This in turn will result in increased aldosterone release. So this is the mechanism of action of thiazide diuretic. Now coming to the pharmacological effects of the thiazide diuretic. Thiazide diuretic will cause decrease in the sodium and water retention. This ultimately results in decrease in the blood volume, and this results in decreased cardiac output as well as decreased peripheral resistance. These changes brings about decrease in the blood pressure. So when you use thiazide for the long term, it will result in vasodilatation and that will result in decrease in the blood pressure. Apart from this, thiazide diuretics also decreases the urinary calcium excretion. So that will result in hypercalcemia. Now coming to the pharmacokinetic properties of the thiazide diuretics. These are well absorbed orally, and after the administration, diuresis usually occurs within 1 hour. Half-life of hydrochlorothiazide is 3 to 4 hours and chlorthalidone is about 44 hours. Chlorthalidone is the longest acting thiazide diuretic. Now coming to the therapeutic uses of the thiazide diuretic. So thiazide diuretics are the first line drug for the treatment of essential hypertension. It is also used for the treatment of edema due to the congestive heart failure, which may be of mild to moderate severity, and also in case of the liver disease. Thiazides are also useful for the nephrogenic diabetes insipidus and in case of the calcium calculi, which is known as nephrolithiasis. So thiazides causes paradoxical decrease in the urinary output, and the volume depletion which is caused by the thiazide ultimately decreases the glomerular filtration rate. So that is the therapeutic basis for its use in the treatment of the nephrogenic diabetes insipidus. Apart from this, when you are using thiazide, lithium toxicity can occur because lithium reabsorption is increased by the thiazides. So if you are using lithium along with the thiazide diuretic, you have to reduce the dose of the lithium by at least 50%. Now thiazides can promote distal tubular calcium reabsorption. As thiazide prevents the calcium excretion, it can lead to the stone formation in the ducts of the kidney. So as the thiazide promotes the distal tubular calcium reabsorption, it can be used in the treatment of the recurrent calcium calculi. Now coming to the thiazide side effects. So thiazides can cause hypokalemia. and this is due to the increased availability of the sodium for the exchange at the collecting duct and the volume contraction induced aldosterone release. Thiazides can also cause loss of the magnesium ion. Thiazide causes direct competition for the urate transport, and it increases the level of the uric acid in the patients, so it can even precipitate the attacks of the gout. So in the patients of hyperuricemia or in the patients of gout, the thiazide diuretics should not be used. Thiazides also causes decrease in the insulin secretion, and that is due to the hypokalemia, and that is the reason it can result in hyperglycemia as a side effect. Thiazides can also result in hyperlipidemia, hypercalcemia. Sometimes it can also result rash and photosensitivity reactions. Now coming to the contraindications of the thiazide diuretics. Thiazides are contraindicated in the toxemia of the pregnancy because it can compromise the placental circulation and it can lead to the miscarriage or fetal death. Thiazides are also contraindicated to use during the severe renal failure. So this was about the thiazide side effects and its contraindications. Now coming to the major drug interactions with the thiazide diuretic. Thiazides causes hypokalemia and that can enhance the digoxin toxicity, and this ultimately results in increased risk of polymorphic ventricular tachycardia. Thiazides, if they are used along with the NSAIDs, it can result in decreased diuretic effect as the NSAIDs are known to inhibit the prostaglandin release from the kidney. So these are the major drug interactions of the thiazide diuretics. So to summarize about the thiazide, thiazides mainly acts in the distal convoluted tubule by inhibiting the sodium chloride symporter. This ultimately will result in hypokalemia and hypercalcemia. These are its major side effects. It can be used as a first line drug for the essential hypertension. It can be used in the edema due to the cardiac, renal, or liver disease as it produces moderate diuresis. So, this was about the thiazide diuretic. If you like the video about the thiazide diuretic, share and subscribe my channel. In the next video, we will talk about the loop diuretics. Thank you.